Healthcare Surrogates: Integrating Law and Ethics by Lori English, Nathan Winterburn, and Colin Rabach. A 32-year-old woman was admitted to the trauma intensive care unit following a motor vehicle accident. She had multiple injuries and fractures with several complications, which continued to develop over the first couple of weeks. The patient entered a comatose state that night at the hospital and was placed on a ventilator. Shortly after the patient's admission, her soon-to-be ex-husband was unable to be contacted. Thus, the second emergency contact, the patient's parents, were contacted and remained vigilant at her bedside. They reported the patient was 1 month away from having her divorce finalized and relayed their concerns. The patient's husband was reportedly physically and emotionally abusive to her throughout their 5 years of marriage, and she had been recently admitted to the ER for facial bruising and a laceration that required stitches. Despite the nearly finalized divorce and apparent abuse, he is her current healthcare surrogate and insists he can and should make her medical decisions. After reading this case, there are overarching questions which need to be addressed in order to conduct a thorough analysis from all viewpoints. Question 1. Given the known abuse, should the husband be responsible for treatment decisions which the patient cannot make? Question 2. What are the ethical and legal parameters regarding this case?
In order to analyze this case from all sides, it is best to disconnect the issues through the perspectives involved. With that being said, the parents, the husband, and the hospital's perspectives are all utilized and taken into full consideration. It is understandable that they have no desire to keep the patient's current healthcare surrogate in control of her medical decisions. The parents do have the ability to make a petition for temporary guardianship, which would allow them to have authority to make medical decisions for their daughter, the patient. However, to do this, a petition for guardianship is required to do so. Given the known abuse history with the husband, it is likely that they would grant temporary guardianship for the parents until the daughter's divorce was final. Then the surrogate and the power of attorney could be reassigned after the divorce went through. This would allow the parents to gain power and make medical and financial decisions on behalf of their daughter. The patient has a right to autonomy. Her parents have the ability to make medical decisions on her behalf, may be interpreted to be in violation of her own rights to make her own decisions. An ethical dilemma that is present in this case is that between the parent's right to make her medical decisions and her inability to express her desired treatment plan. If the parents are granted guardianship for their daughter, they are obligated to make the medical decisions to the best of their ability to what their daughter would have wanted. They are responsible to make this decision with their daughter's best interests in mind. Until the parents receive guardianship for their daughter, they will not be allowed to be involved in any part of the treatment plan. They will not have any say in the treatment plan, and this means that they will be not allowed to make any medical or financial decisions until they are granted that temporary guardianship. Any decisions made about the patient's care plans should be made according to the principle of beneficence, which is a principle of doing good. Until the legal issues within this case are addressed, the soon-to-be ex-husband will still remain the patient's healthcare surrogate.
In this case, the husband would be appointed as the surrogate who would make the decisions regarding his wife's health and finances. The husband needs to follow certain rules when making decisions for his wife that include making decisions in accordance to her wishes, morals, and beliefs.